Hi, I'm just back from a summer holiday in Scotland on the west coast on a lovely Scottish island. We always love going over to the Scottish Isles. And on these islands, I quite often see bones lying around. They're nearly always sheep bones. And here are some ribs lying around, some spare ribs from a poor dead sheep. And this got me thinking about something that one of my colleagues said to me a little while ago. He said, I saw a patient recently who had some rib cage pain, and this colleague of mine said that he just thought it was that the patient's ribs were out, quote unquote, which is something that I've never really understood because this patient's pain had come on for no reason. So I thought today I'd just run through different causes, in my opinion, about what causes rib cage pain. So it's not an exhaustive list of what goes on. It's just a thought off the top of my head about what might cause pain in and around the rib cage that might bring a patient in to see a chiropractor. And I hope it'll just give you a few differential diagnoses and some food for thought. So yeah, these views are all my own. It's not an exhaustive list. I'm sure you can come up with some other ideas. I probably missed off some really obvious ones, but anyway, let me know in the comments below what you think. So okay, ribs, you can break them, of course. This happened to me last year when I was cycling in Scotland. It was a really wet downhill, and my front wheel jammed, the brake jammed on, and I slid and fell, bump, and very painful on the right side, painful to breathe and cough, and yeah, I'd cracked a couple of ribs, and it was painful for about 2 months actually, painful to lie down, painful to laugh, and yeah, I'd probably crack some ribs. What do we do about it? Mostly nothing. They just get better all of their own. I've cracked ribs coming off a bike before, so that seems to be the only time I've cracked ribs. That seems to be when lots of people crack ribs, but I've had patients who have cracked ribs just turning over on my treatment couch because they're very osteoporotic. There are lots of cases of people having ribs cracked when they're treated in side posture treatment if they're osteoporotic, so to be careful about that when you're putting your patients into a side posture position. So some people tape ribs using sports tape to stabilize them. I don't know that the evidence is compelling about that, but you kind of feel like you're doing something which is good. You could do some soft tissue work, I guess, to the intercostal muscles. Would it help? I don't know. Probably just be painful. The cottage we were staying in had some cedar shingles, which you can see here. Beautiful cedar shingles. It's a bit odd, really, because most roofs on Scottish properties are made of slate, so I don't know why they'd use cedar shingles. Obviously got a cheap job lot from somewhere. Cedar has lots of oils in, which helps it to last quite a long time. Lots of anti-rot oils. But anyway, shingles are something that you can get on a intercostal nerve, and they can sometimes, well, they do present as pain around the rib cage quite commonly. And initially, when shingles presents, you don't have a rash, so sometimes patients come to the chiropractor saying, I've got this pain, I've done something, and the chiropractor thinks they've done something mechanical to the ribs, but they haven't. And then a day or two later, you get a phone call from the patient saying, I don't know what massage cream you used, but I've got this rash around my ribs, and it's nearly always in a line following the line of the nerve because it's a viral infection of a nerve root that's broken out, and it starts off looking a bit like insect bites. So if it looks like insect bites which then become a bit crusty, you pretty much know it's shingles. But if that happens and someone has a rash, then it's really worth saying, look, if you get a rash, go straight to the doctor and get some antiviral medication, some acyclovir. It really helps reduce the intensity of the pain and the course of the longevity of the symptoms. So if you think someone might be developing shingles but you can't see a rash, just tell them to keep an eye on the area, and if they develop what looks like an insect rash, to phone up the GP and say, I think I've got shingles, can you prescribe me some acyclovir? The patient will be very grateful to you. Pain can spread down into the ribs, the upper ribs from the neck. So sometimes people will come in with pain in the upper trapezius area, and it's simply coming from the neck. And when you palpate the neck's tender, the neck's restricted in movement to the ipsilateral side. So this is spreading of pain or referred pain down into the rib cage from the cervical spine. That happens. But in an older patient or someone who's very short, someone who's maybe achondroplastic, particularly if they've got severe pain, they can present with pain down into the shoulder area, the scapular area, and down into the arm even, due to compression of the spinal cord. So it's really worth thinking if they have a lot of pain down in the rib cage area and you're thinking, gosh, this seems like a trapped nerve, do some tests to see whether they've got some cord compression. So it's worth standing them up to see what their balance is like. Sometimes these patients will tend to fall forward when they close their eyes. Test their reflexes to see if the reflexes are exaggerated. If there is cord compression, you will sometimes see an inverted C7 reflex. So when you test the C7 reflex, instead of the triceps contracting and the arm flicking outwards, the biceps will contract and the arm will move in, and that's pretty pathognomic of spinal cord compression. So yeah, that's someone you don't really want to be manipulating their neck. And just while we're talking on this subject, it's really worth testing these patients' legs, because you will find hyperreflexia. You may find some clonus when you dorsiflex the foot sharply, and you may get some downward movement of the big toe when you scratch the plantar aspect of the foot up towards the toe, so otherwise known as the Babinski response, positive Babinski response, and you may get some weakness of flexion of the hip and of extension of the knee. So, and if those patients are complaining their legs are giving out, again, be wary of that. Incidentally, cord compression can also cause poor bladder control. So if someone's saying, gosh, my bladder control is not good, I'm having an accident, I'm wetting myself, I'm going all the time, then again, another good reason to think about spinal cord compression. But sometimes one of the main symptoms will be pain down in the shoulder blade coming from the cervical spine. Of course, the ribs protect the lungs, and if patients have problems with their lungs, they can get pain in the rib cage. But these patients will nearly always have a cough or a wheeze, or be bringing up stuff. So hopefully that'll be fairly obvious if someone has a cough or has had a cough for a little while and they've got pain in the rib cage area. Just think, I wonder if they've got a chest infection. They may need some antibiotics and maybe a chest x-ray. If the patient has pain on the right side, around the bottom end of the scapula and round the ribs on the right side, just think that, I wonder if they've got gallstones. That quite often can present with pain on the inferior aspect of the right scapula, pain around the ribs on the right side. So it's really worth, with these patients, having a good poke into the right upper abdominal quadrant and around the right flank and see whether that's tender, because these patients may benefit from an ultrasound scan of the abdomen to see whether they've got gallstones. And it can appear very mechanical, and the pain can go, and if that coincides with you treating them, of course, you'll think that your treatment has been fantastically helpful, which it may or may not have been. Liver problems will also give pain in that same area, lower part of the rib cage on the right side. So if someone's got hepatitis, if they've got some sort of inflammation of the liver, or indeed I've seen patients with metastases in the liver which give pain in the lower part of the rib cage, and these are very easily missed. So if you have pain in that area, particularly if it persists for any length of time, do think about their liver and maybe referring them for some routine blood tests. Pain on the left side of the rib cage could possibly come from the spleen. So the spleen is involved with production of cells for our immune system. So if someone has a leukemia or a lymphoma, there may be issues with the spleen, which may give pain on the left side. I have seen one or two patients with very large spleens, invisible on ultrasound, and it's made the rib cage bulge on that side. So if you're examining the patient, you can see there's a bulge of the ribs on that left side. Just think to yourself, I wonder if they've got splenomegaly, and particularly if they've got some large lymph nodes elsewhere, just wonder whether they've got one of those pathologies. Pain at the front here of the rib cage here, sternal pain can be due to reflux. Obviously, people can say I've got indigestion, but it's very difficult to differentiate that from cardiac pain. So, you do have to think about whether these patients need to be assessed, for a heart attack, whether they need to have an ambulance called if they've got anterior left chest pain that's of recent onset. Again, I would be tempted to call an ambulance and see if the paramedics will do an ECG. If the ECG is abnormal, then these patients need to be taken to hospital for a blood test, see what their troponin levels are like, see whether they have had or are having a heart attack. You could save someone's life by doing this. I have had patients where they've had pain around the rib cage and below the breast, and they've had ECGs which have been okay, they've had blood tests which have been okay, but they've had intermittent episodes of pain in this area, and they seem to have responded to physical therapies, particularly using sort of the vibrator type thumper machines that some of my colleagues use, but the pain keeps coming back, and actually it's turned out that either they've had a problem with a heart valve or they've got a form of angina. So again, any persistent pain around this left side, just think, well, what's inside there apart from the lungs? If they haven't got a cough or anything, but it's got persistent or recurrent episodic pain around the left side of the chest, just think it might be a heart problem of some sort. Now, I think a common heart problem that is seen by many practitioners, including chiropractors, is pericarditis. And this is where you have some fluid around the heart. And the thing about fluid around the heart is that it can compress the heart. And of course, that can be life-threatening. But most episodes of pericarditis don't do that. They're just mildly uncomfortable. And it's very positional. So patients can get this pain as they change position. And I had a pericarditis a number of years ago, and I had this pain around my left rib cage when I bent down to tie my shoelaces, and I had to tie my shoelaces very quickly and then stand up again, and it was because I had pericarditis. I'd been a little bit run down at the time, I was a bit stressed, and I developed this fluid around the heart. It is quite weird. I mean, medically it's not an emergency unless the patient's having problems breathing or getting consistent pain, but these patients normally just respond to time and ibuprofen, and it normally just goes away. So I think ibuprofen is commonly undiagnosed by medical practitioners. I certainly think it's very undiagnosed by chiropractors and physiotherapists because it seems so mechanical. But ideally you do an ultrasound of the heart and see, like you can see in this picture here, a little bit of fluid around the heart. This is the heart, this is the pericardium, and this black line, this is fluid. Okay, there are plenty of other causes of rib cage pain, I'm sure, but the main thing is for us to switch our brains on and try and understand why the patient has rib cage pain. Is it something that needs some additional treatment? Will it pass with time? Is it a postural issue? I think a lot of the time rib cage pain is reflective of something going on inside. The question is, what's going on inside? Is it something really sinister, or is it something transient that will just go away again? That's what we have to think about. That's our job. Hope you enjoyed it. Thanks for watching. Bye for now.